Welcome everyone to large group session. Tonight we have a guest speaker, Megan Cortes. Tonight's topic we'll be learning about what EMTs do and how they respond to emergencies. A little bit about Megan is that she graduated from FSU in 2021 with a degree in neuroscience. And right now she's working as a medical assistant using her EMT license at an urgent care clinic before she starts med school in August. Super exciting. All right, so that's Megan. So I'll pass the torch now. Oh, and if anybody has questions throughout the meeting, you can throw it in the chat, or if that's okay with you, Megan, we can leave the mics off.
Yeah, that's fine. You guys can just shout it out. I don't care about you interrupting me. It's okay. So hello, everyone. Like Natalie said, my name is Megan, graduated from Florida State in 2021. So let me just share my screen real quick. Alrighty. So just a little bit about me again. I majored in behavioral neuroscience and minored in social welfare. And I received my EMT license in the summer of 2020. So my EMT license, it took me 2 months to get it. I'll go a little bit more into that in a little bit. And I'm currently working as a medical assistant at urgent care in South Florida. So originally I'm from Del Rey, which is on actually basically parallel to Sarasota, just on the East Coast. And I applied to medical school and I'll be going in August. So how I got started and why I chose EMT. So FSU has this program and it's called the Medical Response Unit. I cannot say enough good things about MRU. What they do is they give you your EMR license, which is Emergency Medical Responder. So for 1 semester, I went to a class that was paid for by FSU, and I learned basic life-saving skills. So we did triaging, splinting. Triaging is just a fun word for taking vitals, getting a patient's history, figuring out what medications they take, and kind of getting a summary of what's going on with the patient. In the summer of 2020, I decided to do EMT school through TCC. So the Medical Response Unit pairs with TCC, that's Tallahassee Community College, and they do an EMT program. So it was 12 weeks with lecture, lab, and clinicals. So lecture was just like any other classroom. We would sit and my instructor would talk to us about what was going on. So we learned everything from how to get a blood glucose level to how to deliver a baby and how to splint a broken leg and what to do in an emergency situation. And then the lab was learning those skills, so applying them. So big skill we learned was splinting. And we would spend days just going over different splinting methods. And we ran things, we call them scenarios. So the teacher would say, all right, Megan, you're taking lead, and I would be in charge of our crew, which is normally 2 or 3 people. And I would be the one in charge of the call. So I would say, oh, we're gonna give this medication, let's splint them. A big part of EMT and why I chose EMT is because EMTs are trained to think for themselves. When you're an EMT, you're the one on scene, you're in charge. There's no doctor, there's no teacher telling you what to do. You're the one who's in charge, and you really have to think for yourself and figure out what to do. Big decision EMTs make a lot of the times is, are we going lights and sirens, or are we just taking them to the hospital, or are we letting them go home? Being able to figure out what's going on with this patient is very important, and it's a skill that now that I have it, I use it at work all the time. So it gives you that hands-on experience. At work, I work at an urgent care, so I don't know what the one on the West Coast is, but we use MD Now. In Tallahassee, it's patients first. We have patients that come in for, oh, they have the sniffles, but we also have patients who come in with cuts, and we have chest pain, so you kind of have to move quickly. But when we have so many patients, as the medical assistant, as the EMT, I'm in charge of saying, okay, what do I need to bring to the doctor's attention? because they just get the big list of patients and they're going by who came first. But if a patient's having chest pain, they have a high blood pressure, I did an EKG and it looks abnormal, okay, now I have to make the decision and call it to the doctor's attention. And learning and the training that I got as an EMT really let me be able to develop this skill. It also opened a lot of doors for me to work. So I worked as a CNA in the hospital for a few months down here in Delray, and that gave me the opportunity to see a lot how the hospital ran. And I used my EMT license. I'm not a CNA, but I used my EMT license and they hired me. Now I'm working as a medical assistant. Obviously, you can get a medical assistant certificate, but as an EMT, I'm able to do that as well. And they taught me phlebotomy, so I didn't have to pay for a separate phlebotomy class. I just got the phlebotomy training on site. And I know other EMTs who are working on the ambulance, which you can also do. Palm Beach County, which is where I live, is a little different. EMTs can't ride on an ambulance unless you're a firefighter. But Leon County, which is where Tallahassee, it's in Leon County, they have a whole separate EMS system. So when I was in Leon County, I was able to work as an EMT on the ambulance, which was really cool. And medical school people, they love EMTs. That is one thing I came across. They're like, we get dozens of MAs, we get dozens of CNAs, but EMTs, because of what I said before, they're trained to think for themselves. Med school admissions are always going to love you. You stick out. There's not a lot of EMTs, and they know that you can work under pressure. They know you know how to learn quickly and on your feet, and they know that you're good with people because you have to be able to talk. Healthcare is a customer service field. You have to be able to talk to patients, get them to trust you, and give you all the information very, very quickly, because that's how quickly EMTs and first responders have to move. Kind of a day in a life. So depending on the job, the pay can range from $11 an hour to $20 an hour. We do basic things, take vitals. So that's blood pressure, heart rate, oxygen, respirations, sometimes blood glucose, depending on the situation. And again, there is a time where, am I gonna get the blood glucose or does it not really matter? Basic medication administration. So when you're actually on the ambulance, you can give, if I remember, at least the Tallahassee protocols, you can give aspirin, Zofran, very basic things. As I work as an MA, as long as the doctor orders it, I can basically give pain medications, antibiotics. Today I gave a breathing treatment, a nebulizer treatment, and that's really cool because I heard what the patient's lungs sounded like before their treatment, very raspy, and you kind of can hear like the gook in their lungs. And then like after the breathing treatment, I listen to their lungs and you can hear how they clear up. And you can do small procedures. I assist on basic stitches. I've learned a lot working at the urgent care, and I've learned a lot on the ambulance as well. And provide BLS. So BLS stands for Basic Life Support. It's a certification. If you're CPR certified and AED certified, you're BLS certified. And I'll explain a little bit more how that separates us from maybe a paramedic or a nurse. So what I love is working alongside healthcare workers, nurses, doctors, PAs, nurse practitioners, even our front desk people at the urgent care. I love being able to talk to them and learn from them. Something I loved about working in Tallahassee was that when you bring a patient in off the ambulance, if you went to TMH, Dr. Redfield, who is an amazing doctor, he would always ask you, he's like, okay, so like, what do you think is going on? Like, what should we do? And it's that communication within the field that I just love so much, because it makes me feel more like a team player. And being an EMT, you're part of the team. You're not just, oh, the person taking the vitals. You're part of someone who's helping solve the problem and helping that patient out. So just a little bit about the difference between an EMT versus a nurse versus a paramedic. I know a lot of the times it can get a little bit confusing. So nurses, they administer more medications directly ordered from the doctors. And I'm talking about bedside nurses. So these are the nurses that you see in the hospital. They're going around, they take vitals, they give medications, they can start IVs, and they help with the continuity of care. So most nurses who work in the hospital, they do 12-hour shifts. So 12 hours in the morning, they go home for 12 hours, and then they come back in the next morning. And normally they work 36 hours a week, and unless they pick up more shifts, but it helps with the continuity of care, which is a really important thing because then you get to know your patient. So if they treated Mr. Jones Monday, then they come back on Tuesday, Mr. Jones is still there, they're their nurse. And then the patient's able to trust that nurse, able to talk to that nurse, build a rapport, which helps patient outcomes. It's nice to know who you're working with and who's taking care of you. So nurses get to do that. Paramedics, on the other hand, they're basically super EMTs. So they did 2 extra years of training. They did more clinicals. They were able to start IVs on the ambulance. They can give a lot more medications, and they have ALS certification. So that's advanced life support. So they're able to do a little bit more than an EMT would in order to keep that patient alive. The ambulances in Gadsden County, which is a county near Leon County, I think it's just a little bit west of it. So they have BLS ambulances and ALS ambulances. The BLS ambulances have 2 EMTs. ALS ambulances have a paramedic and an EMT. So the ALS ambulances go to the ones where the chief complaint or the reason why the patient called us is chest pain, or they're the ones who go to car flipped on the interstate. So they're able to provide better support for the patients. And that's kind of all I have to say about being an EMT. Do you guys have any questions?
I have a question.
Yes.
Can you explain, at the beginning you talked about an EMR, emergency medical responder. Can you talk about the different training as far as how long it takes to do EMR versus EMT?
Yeah, so EMRs, they're trained within a semester. So again, 3 weeks. You need, in order to do the fast-track EMT license, which is what I did, you need your EMR before you can qualify for that. So full-time EMT, if you guys, any students wanted to become an EMT, takes about a year, so 2 semesters worth of school.
I have some questions.
Yes.
So you talked about at the beginning about the lights and sounds versus just lights. So what are the differences that would warrant lights and sounds versus just lights?
So lights and sirens is we have to get this patient to the hospital right now. So on the ambulance, we're able to do the easiest one. The most common complaint is chest pain. We see it all the time. So we're able to do an EKG. So if this person is having a MI or a myocardial infarction, or as common people call it, a heart attack, we're able to just get them going real quick. Like I said, we have to make that judgment call. When we just do, we're just driving the ambulance down the road, most of the time the patient's not in immediate danger, but they do need to go to the hospital for something. I'm trying to think of a call that I did where we didn't do lights and sirens. Someone was having just stomach pain. They had been throwing up a lot, but their vitals were stable. They were pretty stable. We got an IV in them, so we were hydrating them, and we were able just to drive down Tennessee Street and get them to the ER. But again, that's a time where the EMTs and the paramedics, we have to make that judgment call. Do we think we need to turn on the lights and sirens? Because we can't do it all the time. You have to think, we have to stop traffic. And it's important that we kind of are regulated in some way. Not everything is a need to burst through going 15 miles over the speed limit in a glorified U-Haul truck. So
Do you drive the truck?
yeah, I'm certified to drive the truck, and they trained us in a U-Haul. That's why I say that. We got in the parking lot of TMH and we had to back it up and we had to do like a serpentine through the cones. It was fun.
Very cool. There's a question in the chat. Do you regret being an EMT?
Oh, absolutely not. I love being an EMT, and I said that if I didn't get into medical school, I was gonna just be a paramedic. And I really considered it just because paramedics, you can do something that really drew me to it was you can do wilderness paramedic. So you could go out and be on search and rescue teams in national parks. It can be a full career, and you're able to really explore different options, and it can take you wherever you want. I would, even as a stepping stone to get into medical school, it has taught me so much about seeing how different doctors work, seeing how the kind of doctor I want to be, seeing just different patients and being able to talk to them. I don't get easy patients all the time, and being able to learn to talk to them to kind of get the help they need, get where they need to go. It's taught me so much.
Very cool. Have you ever been in a stressful or challenging situation, and how did you remain calm?
So yes, I have been in some pretty stressful situations. I think, and this is a little gory, and it kind of answers the next question, one memorable experience. This guy came into work one day and he didn't speak any English, and his arm was broken and it was an open fracture and it was bleeding, and he had a trail of blood coming out. And I asked him how this happened, and he said that his arm got sucked into an industrial vacuum. So when this patient came in, the doctor was in another room talking to another patient. And this is a doctor who, I love Dr. G, but he loves to talk. So he kind of, he'll go into a patient's room for 15 minutes. So I had to knock on the door and be like, hello. But during that time, it's stressful because I had to act as a translator, but I also had to act as an MA, but I also had to get the correct story. Just because of we had to make sure if it happened at work, you have to file them under a certain bracket, their workers' compensation. It's a whole different insurance mess. So I was like, did it happen at work? He said no. And I said, why do you have an industrial vacuum at home? And he was like, oh, it was a little stressful because I was trying just to get the truth from him, and he didn't really want to tell me the truth, which for whatever reason. But remaining calm, the thing that gets me through, I'm very goal oriented. So my goal was, I knew this guy was going to the ER because we're not dealing with that at MD now, but I needed to get the full story, and I needed him to be stabilized. I couldn't send him with his arm in his truck because he didn't want to take the ambulance. And you just have to remember, we're a team and we're working together, and we all have to work. So Dr. G and I had to come up with a plan to get his arm just at least a little bit stabilized, not bleeding so much so he could drive the 15 minutes to the hospital. And you also have to remind yourself that you're there to help. Without you, the patient would be worse off. So you just have to keep telling yourself, remaining calm, because even though it's exciting for you, it could be their worst day. And something we learned in EMT school too was we'd be like, oh, it was so quiet, we didn't see anything cool. what you think is cool is someone's worst day. So this guy, I was like, oh, this arm is really cool. And I'm like texting my friends and was like, you should see this guy's arm. It was also Halloween, so it was even crazier. But that was that guy's worst day. He ended up having to go to the ER. We had to call and make sure they had like a reconstructive hand specialist because all the skin was off of his hand. It was degloved. That's what they say when it basically looks like his skin was a glove and it got pulled off. And it was broken. So I just try and remind myself, this is their worst day. Let's not try and make it worse. I don't know. Someone else said, one memorable experience that you have of someone or something. So obviously hand guy was pretty memorable, but a lot of patients, for me, I can't think of one specifically, but I love talking to patients and I love hearing about their lives. One really cool lady, she was 98. She came in with a cat bite. And the coolest thing about her was that I said, oh, what prescription medications do you take? And she said, I take none. And I said, have you had any surgeries? And she said, no. Well, she had like a C-section or something like that, like very like healthy little lady. And she was like, the best thing that I can tell you is just be kind to everyone. And so I always talk to patients. I ask them about their life because it helps calm them down, but it also is interesting really just to learn about different people and learn where they're from and get their whole stories. And they always have fun advice or funny stories to tell. Any other questions?
I have a question. Since you've gone through the process of, like you said, you got your placement in another state and all that good stuff. So you've gone through the interview process and everything. How do you feel being an EMT has helped you with that process? And did anybody in those interviews bring that up? Like it was interesting to them, or maybe it was a positive point to the interviewer?
Yeah, so definitely just talking about experiences that I have here. In med school interviews, they'll ask you, some of them put you in situational things. So give me a time that blank, blank, blank. Or a lot of them like to ask questions that are way above my scope of thinking. How are you going to solve the lack of primary care physicians? Or how would you solve universal health care? Things that really make me stop and think and say, I don't know. No one really has a solution for that. But one, I think fast on my feet because I'm an EMT, but also it gave me the experiences so I can talk about, we had one patient who came in and they didn't have insurance, but I went out of my way one week and I made a list of clinics that give free shots for kids. And when patients would come in uninsured and want the need to get shots for their kids to go to school, I would hand them the list, like off the record. I'd be like, by the way, you could go to all of these places that don't charge $200 to get your kid vaccinated and stuff like that. I learned how to be, as an EMT, you learn how to be a critical thinker and you learn how to just care about your patients and be compassionate, and you're working one-on-one with them. And especially in urgent care is it's a special place because a lot of the patients that come in don't have primary care physicians. So they'll come in and have blood pressures that are way too high and need refills on their medications, and they haven't been to their doctors in weeks and in months or years, and they just are on the same medication that's not working. And as urgent care doctors and urgent care providers, there's really not much they can do. They can give them a refill for 30 days, but eventually they're going to need blood work and lab work. So being an EMT, I've kind of, I talk to patients, I print up lists of primary cares who are willing to accept Medicaid or Medicare, and you try and just tell the patient and remind them the importance of going to see their regular doctor, following up. A big one is for girls in their 20s, not having a gynecologist and needing a gynecologist. And that's very scary for a lot of women. So just, being able to remain professional, but also give the sense of like support and having a shoulder to lean on. That's something that EMT taught me. And that's something that I was able to talk about a lot in my admissions interviews, because as much as scores and as much as GPA is important, med schools want to see that you're a human, that you're going to be compassionate, that you're going to care about your patients. All the medical schools I applied to are very much like FSU in the sense that they're community focused and they want to support their community. So being an EMT, I would always talk about how I'm a member of the community. I am a first responder in my community. I see firsthand every single day the people that make up my community, rich, poor, all races, all genders, all ethnicities, all these different backgrounds. And it really helps you learn a lot about the different cultures, which is another thing I like to bring up. And for the question that if admissions ever called me out on it and really enjoyed it, so I got into Rutgers in Newark, and they invited me up to Newark for a banquet for all the accepted students, Latin accepted students. So I went up and I also did a tour and I met a bunch of different medical students, and I was talking to an undergrad and he was doing his EMT license, and I was also with the dean of admissions. And the dean of admissions was like, you should do EMT. Megan's an EMT, and like talk to her and she knows so much about it and she'll tell you to do it every day. And in Newark, they're on the ambulances and they're in the hospitals. And Newark 2, the hospital that they work at, is the only public hospital, which there's private hospitals, there's public hospitals. Public hospitals see all the uninsured people. So that means you see everything from gunshots to advanced stages of any skin diseases, really big tumors, which again, someone's worst day is also something really cool to see. And it's a great learning experience to be able to learn how to treat that and act with patients like that. So yeah. I think there's one more question. Okay, so the steps for coming an EMT. So you have to have your high school diploma. I did EMR at Tallahassee Community, or I did EMR through FSU, through a program FSU had called the Medical Response Unit. But a lot of the community colleges also have EMR licenses, so that takes a semester. And then the following semester, you can get your EMT license, which we met 3 times a week for 6 hours. So 3 hours was lab, 3 hours was lecture. And then we also had to do clinicals. So the clinicals, I was the summer of COVID, so ours kind of got short, but clinicals, we had to do 10 ride-alongs, 8 shifts in the hospital. So 8 shifts in the emergency room department, and then 2 shifts labor and delivery. So 2 shifts where you're delivering babies. I didn't get to do the labor and delivery because of COVID, but I heard really fun stories. It's always really cool to, get to hold a baby and help deliver a baby and bring life into the world. So, and then after that, you can take, I highly recommend, you don't have to, but it's highly recommended, you take the national board to be an EMT so that you can practice all over the country. So for a while, my sister lives in Boston. I was thinking about moving up to Boston and hanging out with her for my gap year. And to get my EMT license switched over to Boston was $10 for it to work in Massachusetts. Where if you're not nationally certified, you have to take the whole board for Massachusetts as well. So you take your Florida board and you can take your national board. And once you have your national board, you just renew it every 2 years. You can just take a little test at home and get it renewed. Will it be easy to change careers from an EMT to another? So yeah, once you're an EMT, you can like, I'm going to med school, so I'll go and be a doctor, but you can then be a paramedic, which takes 2 extra years. And then from paramedics, a lot of schools now are offering bridge programs to be from paramedic to a nurse. And then once you're a nurse, that opens up so many doors, because you can do bedside, which is a little intense, but you could also go work in private practice. From that, you could go and do, I'm trying to think, you could go get your nurse practitioner's license, which then they're a provider. As a nurse practitioner, you're able to prescribe medications. You can open your own practices in some state. I know in California, nurse practitioners can open their own practices. And it's really easy, not easy, it's a lot of work, a lot of school, but it does open up a lot of doors to just keep working through the ranks of an EMT and emergency medicine. Is anyone interested in doing EMT or emergency medicine or being an ER doctor? No. Okay. Oh, very cool. Yeah. You get a lot of experience, and a lot of the people who work in EMS, firefighters, they're nice people. They're very friendly people. Yeah, nurse or EMT. And being an EMT, it's fun. It's fun to work. Like, I work with some great people and I learn so much, and a lot of the doctors are just so willing to teach. And also there's one nurse practitioner, I love working with him. A patient came in the other day and it just said dizzy, and dizzy is broad. Dizzy can mean heart attack, or it can mean, vertigo, or it could mean I ate something bad. And I was like, oh, Tom, like, what do you want on this patient before I bring them back? He's like, oh, you decide. And I ended up being like, oh, we're going to do a urine and decide what to do for that. And then I'll take their blood glucose, because maybe they have a low blood sugar. And it just really helps you kind of, and Tom just gave me free rein. He was like, do what you want. And if I think you're wrong or going in the wrong direction, I'll fix it. But for now, just do what you want, come back with the results. And it was really cool to have that sort of freedom. Oh, I'm glad I could clear that up. So yeah, an EMT and a paramedic, little bit different. Paramedics are just like super EMTs. They have all of the skills, and they're always pretty laid back too. All right, I can answer any questions. Oh, do you get to choose where you want to work at? Yeah. So EMTs, you can be on the ambulance in certain, I don't know if Sarasota is different. Is that Collier County still? Sarasota? No? Okay.
I know Sarasota County.
Oh, it's a whole county.
Yeah.
So yeah, I don't know I know Collier County, it's separate, EMS, fire. So you can work on the ambulance, you can work in the hospital. Paramedics, a lot of the times, work in the ER. You can work on the ambulance or the ER. And yeah, I mean, I work at urgent care. I know other MAs who work at an ENT office, that's ears, nose, and throat doctor. I know other EMTs who work in, one of the girls I used to work with, she went to go work at like a pediatric, she works on the pediatric floor of our children's hospital here. So you can kind of move around and you get to interact, pick and choose what you want to do. How many hours per day? So most EMTs work 12-hour shifts. Gadsden County was a little special. It worked 48 on, 48 off. So you work 48 hours straight, and then you have 48 hours off, and then you work another 48 hours straight. They have beds, they have a gym, they have a kitchen. The people the EMTs and medics who would work in Gadsden County would bring their bags, like a whole duffel bag full of just all their stuff. So normally the smaller counties are kind of like that. It just depends on where you end up working. If you work in the hospital, it's 12-hour shifts. Now it's a little bit less, just depending on like patient flow. Today I worked 8 hours. Tomorrow I work 12 hours. Just depends on where you work. Most places it's 12 hours as an EMT. Is it optional to work on holidays? So unfortunately, in the medical field, a lot of us don't get holidays. At urgent care, I got to pick one holiday. So I had to rank my holidays and I got to pick which one I wanted. And you rank it like, for my first choice was Christmas Eve, because I celebrate Christmas on Christmas Eve. And then I did New Year's Day because that's just crazy and I didn't want to deal with the craziness of New Year's Day at work. And then Christmas Day, you order it and you hope you get one holiday. As the new person, as the new MA, I got none of my holidays. I had to work Thanksgiving, Black Friday, Christmas Eve, Christmas Day, the day after Christmas, New Year's Eve, and New Year's Day. But again, it depends on where you work. If you work in private practice, you get holidays. But that's just kind of the reality of healthcare, because people still get sick, people still get in accidents, people still do everything. It doesn't stop just because it's Christmas. But then I got to see that guy who got his arm sucked in to the vacuum on Halloween. So that was fun, a little gory. How do you manage your work life? That is something that's very important to me, work-life balance. I was talking about that with my boss today. She's a nurse practitioner, but she's the manager of our clinic. And we were talking about travel nursing, because everyone's hyping up travel nursing now, because travel nurses are making like crazy money in 3 months and then not working for the rest of the year, whatever, but they have to work 6 days a week. So it's the work-life balance. For me, for a while I was working 60 hours a week. I'd wake up extra early to go and make sure I had time to run, or even if it was just watch an episode of Netflix, or I learned how to crochet this year, just spending time to crochet. I always made sure I had time for myself. When it came to spending time with family, that's when it got a little tricky. So you have to pick and choose. Have you ever seen that triangle where it's like you get to pick sleep, school, or hanging, like social life? I always choose social life, and school or work. Sleep kind of falls to the wayside. It's important, as much fun as it is to see your paycheck come into your bank account every week and you're like, oh, awesome, making so much money. I actually took time, I pulled back. I went part-time for a little bit at work because I was working 60 hours a week for 2 months. I wasn't seeing my family. I wasn't seeing my boyfriend. I wasn't seeing my best friend. It got to the point where I felt like a robot, and you don't want to get to that. Especially even when I was in school, I never wanted to feel that way. And I got into med school anyway. Life figures its way out. If you don't work the extra, don't pick up the extra shift if you don't want to pick up the extra shift. Now I look at the schedule, it's really bad because I look at the schedule, I see who's working. If it's a doctor that I don't necessarily love and I could pick up the shift, or I could spend the day hanging out with my mom, normally gonna pick the day hanging out with my mom instead of going to work this shift with a doctor I don't like and other MAs who I don't really like, and my favorite people at work aren't there. I have that luxury, but I also work some days and I don't like the doctors I'm working with, but you just smile and get through it. So
Okay, so last call for any final questions for Megan?
I
Going
hope
on.
I answered everyone's questions well.
If anybody has any other questions afterwards, you can email Mrs. Trull and she'll get them to Megan. Okay. Well, thank you, Megan, for leading a great session. It was very interesting and informative to learn about what EMTs do. Congratulations on med school again. You're going to make a great doctor.
Yeah, thank you. You too.
Yeah, thanks.